بتروح النت ببص وين امي؟ والله حكوا يعني ما حد معطيها ريبوك وما حد معطيها
اسمع لا ريبوك ولا بشيء.
Good afternoon all. Hello and welcome to our lecture, the MFD part 2, the online transition. So we're going to be starting soon. So attendees are coming in. So we're going to start in a couple of minutes. So can you hear me clearly? If you hear me, just raise your hand. If you hear me, just tap, raise your hand. Okay, great. Excellent. And what about the others? Okay, perfect. Okay, attendees are coming in. So we're gonna start once everybody is settled. Don't forget, some of you are having problem hearing me. Just click on call via audio. Okay, so you can hear me and I can hear you as well. Okay, just click call via audio. Yeah, Dr. Sana, just click call via audio. If you're not hearing me, call via audio. You don't need to click the video. Yes, you just click the audio. So you can just hear me. Okay. All right, so I guess everyone is settled now. Okay, participants are still coming in. Hello, M. Ibrahim. Yes, Aziz, click call via audio. Excellent, thank you. Okay, how about you tell me on the chat box where you're coming from? Egypt, Jordan, India, Kuwait, Jordan, Iraq, welcome all. We have participants from a variety of countries. Excellent, Saudi Arabia, Sudan, Egypt, Dubai, India, perfect. Okay, yeah, so most of participants are from GCC countries, from India and from Egypt and other Arab countries. Okay, so I guess I'm gonna start now. Pakistan, welcome, Dr. Sana. Okay, thank you very much for coming in and for accepting my invitation to attend this lecture. I appreciate you coming here, especially in this day, on this day, which is supposed to be a leisure day, the weekend. Okay, welcome all from Dr. Nasreen from Kuwait, Dr. Osman from Ireland, and M. Ibrahim from Iraq. Okay, so okay, we're gonna start now. So this lecture is gonna be about the new MFD Part 2 exam, the online transition. My name is Dr. Muhammad. You might have heard of me. Some of you have already taken courses with me. Some of you have not. And I have 2 qualifications from the Royal College of Surgeons of Ireland. I've been teaching the Royal College membership exams for about a year, both Part 1 and Part 2 exams. And I'm very proud to have a very high success rate among my candidates, over 70%, 75% so far. Okay, and participants are still coming in. Okay, we're gonna start anyway. So a brief introduction about myself. I have worked in Iraq in Ministry of Health for 4 years, from 2010, 2014, 2010 when I got qualified. And then I worked in Bahrain, and I've been working there since 2015. It was a hybrid experience, a blended experience. Some of it was done in governmental setting, and some was done, has been done in private practices. So I've been qualified 10 years ago, and ever since I've been a dentist. I've been in a program for 4 years, which is affiliated with the Royal College of Surgeons, Edinburgh in Bahrain. Professional degrees. In 2010, I have gained my Bachelor of Dental Surgery. In 2015, I have gained my membership, my first membership from the Royal College of Surgeons in Ireland, 2015. And my membership in general dental surgery, which is a high-level membership from Ireland in 2017. I've been planning for fellowship, but because of COVID-19, unfortunately, that didn't happen. So areas of special interest. My main areas of special interest are, broadly speaking, restorative dentistry, prosthodontics, functional occlusion, TMJ, oral diagnosis, smile design, and how it's related to patients' functional occlusion and TMJ. So enough about myself. One more thing, I'm founder of the Pioneer Dentist, which is a page on Facebook. You can find it on Facebook. Some participants might have a problem hearing me. Just click via audio, okay? Call via audio. I'm gonna write that because they can't hear me. Okay. Choose call via audio so you can hear me. Okay. Sorry. Okay. So we are mainly specialized in Royal College memberships and dental board exams. So as you know, there are basically four Royal College of Surgeons in Ireland and in the UK. These are the Royal College of Surgeons of England. They offer the MJDF, which is gonna end by October, which is gonna be replaced back to MFDS. There's also RCS Edinburgh, and there's also RCS Glasgow, which is the Edinburgh's college sister, and there's also the Royal College of Surgeons of Ireland, in which most of you are interested. And we're gonna be focusing on that one today. So about COVID-19 this year, and as you know, it has canceled many dreams and hopes, and it was rather disappointing. And it was a really, really harsh year for all of us in both surgical, dental training, and even on our practices and incomes. So how has this disease affected the Royal College exams? As you might know already, that in March 2020, the Royal College of Surgeons, all Royal Colleges, the four of them, they canceled all their exams. They suspended all their exams until September 2020. Complete suspension of all exams because of concerns of the transmission of the virus. So the Irish College was one of the colleges that took the initiative into introducing its digital form of its Part 2 exam, the final exam. And on 25 June 2020, with the first Part 2 exam was held on 13th of June. 15th of June, they announced that there will be also a Part 1 exam for the MFD. Shortly, the Royal College of Surgeons of England announced the MJDF Part 1 online exam that will be held on 5th of October 2020. So it's basically only the Royal College of Surgeons of England and the Irish College, the only ones that are by far, they have the online versions of their exams. Moving on, what do we expect in the following few days? Next week, some of you might have the Part 2 exam in July, 23rd of July. And I wish you all the luck and all the best on this upcoming exam. So, and on 27th of August, the MFD Part 1 online exam will be held for the first time on 17th of September 2020. Some of you might have already registered for that exam, and I wish you all the best. And I really strongly recommend that you prepare very well. Sorry. 6th of October 2020, the MJDF Part 1 online exam will be held for the first time, and on the following day, the MFDS Part 1 of the Royal College of Surgeons of England, which will be held for the first time, which is going to replace the MJDF. Okay, these are the upcoming online exams for the MFD Part 2. One is next week, one is after a couple of months, exactly after 2 months from now. So what has changed in the MFD Part 2 exam? Instead of having a 2-day exam, it used to be a 2-day exam before they switched into the online form. Now it's a 1-day exam, and they basically have 15 OSCEs now, or clinical scenarios. They have changed a bit about their structure. Now they have 15 OSCEs or clinical scenarios. What is an OSCE? What is a clinical scenario? You know OSCEs, all of you know what is an OSCE. It's an objective structured clinical examination. Clinical scenarios are more or less similar to OSCEs, but one different thing is that you have sometimes you'd face a whole clinical scenario along with its history and examination findings. That might be a possible change. 1 hour and 30 minutes is the exam, 90 minutes. So you'd have 6 minutes for each OSCE. Exam subjects are luckily 100% clinical, 100% clinical or clinically relevant basic sciences. No vivas, but they have added 5 more OSCEs or clinical scenarios. Some of you might have frequently asked questions. What will happen if I got disconnected in the exam? Unfortunately, if that happens, your exam will be terminated. This exam is no joke. If you get terminated, you will not get any refund. So you'd have to make sure that you have an optimal exam conditions from the connection, from the charging, from the electricity, everything. So frequently asked questions. How is the exam conducted? Another one. The exam is conducted by a PC, of course, or a laptop with a webcam. You'd basically ideally have a fast connection. A smartphone, I don't think that is necessary with the Irish exam, but possibly in the English exam. But you'd have to check their requirements because they're gonna send you emails giving you full instructions. So the basic setting, how is the setting gonna be? The setting is basically, can't hear me suddenly. Is anyone facing the same issue? Hello all, can you hear me? Okay, Dr. Puch, I think you have an issue. All is good because others are not having any issues by far. Okay. Okay, so moving on. Okay, you'll be sitting on a chair. Let's say this is the table in front of you. And you basically have a keyboard, a mouse, and a monitor, and a whole PC. You can omit all of these if you have a laptop. A laptop is fine, but tablet PCs are not. Surface Pros are not. Okay, that's what they say on their website. You wouldn't have to have a speaker or an audio, but I'd advise you to check the email, make sure whether or not you need that, but I don't think you do. PC with webcam, laptop with cam is okay. Tablet PC is not okay. A mobile phone, I'm not sure you'd need that. A mobile phone on the side to monitor you from the side aspect, but you need to check that from the instructions that have been sent to you, because as you know, some exam providers, they require that you'd have mobile phone on the side to have you monitor throughout the exam. Some of them, they do not need that. And of course, a Wi-Fi connection, a strong Wi-Fi connection, preferably cable. Cable is stronger and more stable than Wi-Fi. System requirements. There are a couple of system requirements that you're gonna receive these in the instructions. A laptop or computer, RAM 4 GB or more, Windows 7 or higher, Mac 10.8 or higher, webcam, internet speed 1 megabyte per second or higher. Of course, the upload is more important than the download. So, so some of you might have a very poor download. That's okay. What matters is the upload, because they don't care if you see them or not, but they need to see you. And that's where the upload matters. That's why they stress on having an optimal upload speed. Cable is better than Wi-Fi. They'd expect you to have a typing proficiency of 40 words per minute, as they mention on their website or their instructions. However, from my experience so far, I have many candidates who have underwent the exam, and their typing speed was far less than 40 words per minute, but they managed to finish all questions. Why? Because you don't need to write a lot. You don't need to type a lot. All you need is just a couple of keywords, 1 or 2 words, and bullet points as well. So you don't need to worry about the typing speed too much. It's good to practice, but don't make that as something that will prevent you from entering this exam. So for RCSI exams, test reach will be used. Dr. Abdurrahman, yes, we will be announcing the intensive revision course shortly. So for RCSI exams, test reach will be used. This is an independent company. They administer online exams, and they are being employed by the RCSI in collaboration with the RCSI. The Royal College of Surgeons of England collaborated with a different company, which is Surpass. I'm not going to talk about it. We're going to focus on test reach. However, if you check on the internet, you'd find no test reach tutorials, unless if you request a demo, or if you register for the exam, they will send you all the information you need to know about how to use this program. They will provide you with the link and everything. So basically, this is from YouTube on how to use Surpass. Surpass is a similar program. Surpass is a similar application to a similar program to test reach. So basically what you need to do after entering all the information and accessing the exam, they might ask you, I think this is only for Surpass, that you need to scan all the area around you to prove that there's nothing around you. But I don't think that you will require to do that, but you need to make sure on test reach what is basically required. And they would need to see your face, and they would need to check your ears, that there are no earphones whatsoever. And the exam will start, and you will be monitored throughout the exam, which means that if they see anything suspicious during the exam, they will ask you to rectify the situation. they will ask you to stop doing what you're doing. If, for example, your eyes are away from the screen, from the monitor, so they're gonna ask you to look at the monitor and not look left or right. Dr. Iman, yes, so thank you for sharing your experience. So they would require, what I understood, they would require you to have a mobile phone. Is that correct? You can turn on the audio and speak. It's okay if any one of you wishes to speak. So did they?
Yes, doctor. Yes, they said that they ask the candidate to scan the area and to search for earphone or any earbuds like this.
Will they ask you to monitor, to be monitored by the mobile phone, by the smartphone?
No mobile phone. Mobile phone is off and not on the table.
Okay, that's the difference between Surpass and Test Reach. Thank you very much. So,
okay.
So what they will ask you is just to scan the area. They'll send you the email with full instructions on what to do. After you scan the area, you have to keep your eyes on the monitor. Otherwise, you might be penalized. They might ask you to be careful, to change whatever needs to be changed. And if you did not comply, the exam might be terminated. So you need to be very careful and watch out for any possible unintentional breaches for exam protocols. Okay, so moving on. So the exam syllabus, let's talk a little about exam syllabus. What to expect from this exam? So the exam syllabus, I have summarized what's all about the Royal College exam subjects in 4 main categories. These are medical. For the part 2, they account for 1/3 of the mark. There's the restorative part, there's the orthopedia part, and there's the miscellaneous part. So basically, they expect to have 5 OSCEs medical, 5 restorative OSCEs, 3 orthopedia or trauma OSCEs, and 2 miscellaneous. So let's go into details. What are the medical OSCEs? You'd expect to find clinically oriented anatomy, oral medicine, oral pathology, oral surgery, medical emergencies, pharma, medically compromised patients. All of these are possible themes in the OSCEs, in the medical OSCEs. So expect you to find 5 OSCEs from a variety of different medical subjects and then that are relevant to dentistry. About the restorative, we can all combine these into a single category that is restorative. These are prosto, endo, perio, and operative dentistry. Of course, prosto would include both fixed and removable prosthodontics. And that will have to include crown and bridge and post placements as well. As for the orthopedia, this is straightforward. Orthodontics, pediatric dentistry, and dental trauma. But these are what concerns the general practitioners at most. So you don't need to go and dwell into orthodontics too deeply in the level of specialists. What they require is the level of the general practitioner. Dr. A.M. is asking whether the exam on September will be online. Yes, it will be online, and they have announced that it will be online on the 17th of September. The closing date of that exam is gonna be next month on August. Miscellaneous subjects: infection control, evidence-based dentistry, laws and ethics, professionalism, and so on. I wouldn't really recommend that you go too deeply into these subjects. Yeah, so it's just gonna be basically 2 OSCEs, and they're gonna focus on the most important subjects in the exam and the curriculum. I'm going to answer the questions at the end of the lecture. So if you have any questions, please write them down on the chat box so I can look into them at the end of the lecture. So the MFD part to ask is, this is not a guide, an authentic an authentic guide. This is just, this has been written by me. Okay. This is just an expectation of what you might find. You'd have to have a different variety of different subjects: anatomy, prosto, fixed and removable, perio, restorative, endo, ortho, pediatric, oral medicine, oral surgery, radiographic interpretation, medical emergencies, and implants. So you'd expect to find different subjects. Of course, we'd have 15 OSCEs or clinical scenarios. 90 minutes, as we have mentioned, 6 minutes per OSCE. So this is one example of a typical clinical scenario that you might expect to find in the exam. When they say clinical scenario, you'd expect to find information from history, examination, photos, or radiographs, or both of them. So if they ask you here, before we ask any question, we have a clinical scenario. So this is a 37-year-old lady attending, complaining of pain from a tooth in lower right quadrant. The patient has multiple caries lesions. The patient has never experienced such a thing before and is quite confused. Why has this happened? So look at the appearance of the caries lesions. One of the things that you'd have to notice in such exams is, what are the types of these lesions? I'm not talking about GV classification. What are the dentinal caries? Are they active or not? How can I know whether they are active or not? And how would I decide whether or not the patient, these are new lesions or not? How can that affect the treatment plan? Why would I need to know whether it's active or not? It's going to affect the whole treatment plan. Medical history, for example, fit and well, takes doxepin. You'd have to have a good knowledge about, basic knowledge about pharmacology and different medications. Social history, recently divorced, unemployed, smokes 10 cigarettes per day. Dental history, brushes once a day, does not use interdental aids. She's an irregular attendee. Okay, so they might ask you, describe what you see here. Of course, you'd have to be systematic here. Of course, this is a frontal photograph. You don't need to answer that verbally because all the exam has turned into a written format. So this is a frontal photograph showing multiple various caries lesions, cervical caries lesions. On the upper central incisors, these are extended to dentin. And there are also decalcifications on the lateral incisors. Also, there's a caries lesion on the upper right canine and upper left canine as well. And as you can see, how can I determine the activity of these lesions? Of course, the lesions appear matte, and they appear to be, there appears to be no luster, which means that they are most likely to be active. They have a leathery appearance. That's one way to put it, to know what type of activity do I have, lesion activity. And that's very important. We want to know, is the lesion advancing or not? Is this a previous problem or is it a recent problem? That's going to affect the treatment plan. So what factors might have contributed to the patient's change in oral health? You have to scan the photographs and the information here and relate them to each other. Of course, the patient is taking doxepin. Doxepin is an SSRI. It's a tricyclic antidepressant. And as we know, all antidepressants might predispose to dry mouth. She's recently divorced. That has caused her stress and anxiety, unemployed, smokes, brushes once a day, does not use interdental aid, a regular attendee. All of these are possible indicators of caries risk, including unemployment as well. This is called social determinant of disease risk. Outline your preventive regime. Of course, every patient, every case has its own regime that you should be aware of. And this can be derived from reputable resources. You can find them on Google, or you can find them on the internet, on different textbooks. Okay, and describe the pathology of dental caries. You don't need to write anything more than 4 words. What are these 4 words? Cariogenic bacteria, acidogenic bacteria, fermentate carbs into acids, acid dissolutes enamel with time. So you have bacteria, carbs, enamel, time. These are the 4 things. That's it. You don't need to write anything more than these. If I had a candidate who would answer that question this way, I'd give him a full mark. That's it. Yeah, that's all you need to write. Don't write paragraphs. That's very important, because if you do so, you might lose time. And time is very important. Time management is extremely important in such exams. And yes, the lesions are active, Dr. Iman, because as you can see, it's matte. Usually the texture is very important to indicate whether or not the lesion is active or not. So this is another clinical scenario, or an OSCE. Describe what you see. Of course, there's an anterior crossbite. What would you check for? There are a set of criteria that you need to check for, certain things that you need to check for before you proceed into making a diagnosis. Outline your management. For example, can the patient achieve H2H? So you know whether this or not, whether this acido class 3. Another thing you would need to know, if the patient can achieve H2H contact, that will affect the treatment plan. Outline your management, and they might ask you to write the design for a removable orthodontic appliance. And what is the main important thing to ensure stability? Of course, there's an overbite. So you need to check that there's an overbite. So we'd ensure after correction that there will be a stable result. Dr. Abdullah is a good question. He's asking about whether or not spelling would affect the mark. That will depend on how severe is your mistake. So if it was a simple mistake and it was done only once, I don't think they'll penalize you. But if there were repeated serious mistakes, spelling mistakes, I think they will penalize. There's another one of the most popular in the exam. This is a white lesion. Yes, Dr. Pucha. Can you repeat this course? You mean the lecture? It's gonna be recorded, don't worry. But we're gonna talk about what we can offer shortly. So describe what you see here. Of course, this is a white lesion. You'd have to mention the site, size, shape, texture, the outline, the color, whether or not there are ulcerations. You have to mention all of these when you describe anything. These might be phased instead of the viva. So what is your differential diagnosis here? You have to have a full understanding of all the differential diagnoses in white lesions. So you shouldn't write everything you'd read from the table. Of course not, because every differential diagnosis has to be unique. And based on your knowledge, you have to know which ones should be included. Of course, you'd have to write the first one, which has to be ideally the most likely one. So what specific information investigations would you look for? This is very important. Specific information can be derived from history, examination, and investigation. We're gonna answer all your questions at the end of the lecture, hopefully. And this is another one about radiographic interpretation. They might ask you, what do you see on this radiograph? Of course, you'd see an expansile lesion, which is multilocular. They might ask you for a differential diagnosis. And following that, they might ask you for the most likely diagnosis. You cannot know for sure unless you take a biopsy, but you can guess the most likely diagnosis here. And based on the answer in question 3, they'd ask you, what is the surgical management here? And they might ask you a couple of more questions about such jaw lesions. Another one which might come up in the exam, you'd have to have, lazim, you should always have at least one slide of histopathology. That is 100% guaranteed, that you'd have one question about oral pathology, having a slide, and they need you to interpret the slide and describe it. And they'd ask you the diagnosis, histopathological diagnosis, and they might ask you a couple of questions about that lesion. For example, what is the shape of the most common variant? What will your management be? What's the prognosis? And so on. So basically, you'd need to know treatment planning, diagnosis, prognosis, and history taking, examination, diagnosis, prognosis, and treatment planning. About references, of course, you'd have a lot of references. One of the most iconic references are the Oxford Handbook for Clinical Dentistry, Applied Medicine and Surgery in Dentistry. And of course, a new book, which is an Oxford Handbook of Integrated Dental Biosciences. This is the replacement of the Blue Book. The Blue Book for Scully, who has passed away a couple of years ago. There are a couple of other references from past tests and so on. What matters and what is really beneficial in the exam, the OSCEs and short answer questions are very beneficial, but that doesn't mean that you shouldn't read the MCQs, EMQs, and best of 5s. Why? Because after answering each question, you'd find the explanation on the other side. And some explanations are very useful in such exams, even if it was for part 2. At least read the explanation, if not the question itself. Of course, Master Dentistry 1, 2, and 3 are very useful in these exams. FGDP standard books, the clinical examination record keeping, selection criteria for dental radiography, antimicrobial prescribing, standards in dentistry, dementia-friendly dentistry, all of these can be very useful resources in the exam. And of course, we shouldn't forget these lovely books. The Clinical Problem Solving in Dentistry has recently published its 4th edition. And there's also Clinical Problem Solving in Pedo and Ortho, Perio and Implant, Prosthodontics. And there's also problem-based learning in endodontics, a very useful textbook. So some of you might wonder, do I need to read everything from cover to cover? And here's the good news. No, you don't. You don't need to. However, you need to know what to read and what to skip. And this really requires some dedication and some understanding of the exam structure and syllabus. So what to read? Everything that is clinically applicable for general dental practitioners. Remember that they are examining you on a general practitioner's level. So they'd expect you to have no specialist knowledge whatsoever. And also, everything that proves you are a competent dentist is required in the exam. Everything that proves that you are patient safe. When you have an oral cancer patient or an ulcer on the tongue, on the lateral surface of the tongue, and you need to rule out oral cancer, they need to know that you have to rule out oral cancer. So they need to make sure that you are patient safe. So what to skip? Specialist level knowledge and expertise. Non-clinically relevant topics. You don't need to dwell too much into basic science like anatomy, pathophysiology, and biochemistry. Just get a hold of what's important for your own practice. They'd require basic science, but not any basic science, what you need in your clinical practice. So if you're still unsure, despite this orientation, you can always seek coaching. So what can we offer? We have an announcement to make. Of our 6th course, we have 5 previous successful courses. So this course is gonna be 8 weeks, an 8 weeks course, and it is especially targeted for the September 17 September exam, part 2. It's gonna be 100% online, the same as the exam format. It's gonna be 100% in English, 4 modules, 30 hours. 30 hours only, because we don't have enough time to take anything more than that, as you may well know. And what do we offer here in the course? All references will be provided in Dropbox, PDF, WhatsApp study group, case discussion with continuous online support, 30 hours of online teaching focused on exam, OSCEs, and scenarios. All lectures will be recorded. You will have a chance to see them later on. For example, if you couldn't see them, you can always view them at a different time. Not just that, I'm also offering 70 hours of lectures of our core curriculum from previous groups for the part 1, which contain the core curriculum for the Royal College membership exams. All the subjects, including oral surgery, oral pathology, restorative dentistry, and the whole core curriculum that I've been speaking about earlier. And access of over 50 hours of lectures of our previous MFD Part 2 courses, in which we had different discussions, some of them in Arabic, so not all of you can make use of these, but these are only supplementary because we're gonna start a new course, a new fresh course, so you wouldn't really need these 50 hours. We're just gonna start a new course. And there are 4 mock tests that will be done throughout these 8 weeks. The 4 mock tests will be will occur in 2 weeks interval, every 2 weeks. And 1 mock test is gonna be about restorative. The other is gonna be focused on medicine. The 3rd one is gonna be focused on orthopedo. The 4th one is gonna be a general one, including all exam subjects. The price of the course, of course, the original price is $500. We're offering you this course for a very discounted price of $200 because we understand the current situations and the hardships associated with these times. So that's why, and above all, it's a crash course. So that's why we're offering it at a very discounted rate. 30 hours course, medical 10 hours, restorative 10 hours, orthopedo 6 hours, miscellaneous 4 hours, plus the mock revision and the whole exam revision, it will be 4 hours. Of course, there are gonna be 4 mock tests. As we have mentioned, medical, restorative, orthopedo, and the final mock for all subjects. That's gonna be held 1 week before the exam. The course overview, of course, the number of hours is 30. So we'd expect to have medicine 10 hours, restorative 10, ortho 6, miscellaneous 4. The duration, some of you might have concerns. Will this course be held at one shot or multiple days? Of course, they are 30 hours. So they can be held in different days, in 4 days, and they can be held in 8 days. They can be held in 30 days. How to choose how many days, that's up to you. The candidate will decide and agree. You will choose the days and how many days. After we settle in the course, you will agree on a specific way and how to proceed with the course. These are some proposed plans. Weekday plan, sorry, 3 hours, not number of meetings, 3 hours per week. Sorry, weekday plan, yeah, number of meetings, sorry, 3 times to 4 times per week. Sometimes weekdays are Sunday to Thursday, 5 hours during weekdays. This is gonna be over 20 meetings per week. Sorry, more than 20 meetings overall. Weekend plans, there's once per week, 3 to 4 hours at Fridays. I think that's gonna be one of the most popular ones, 8 meetings. So there are 8 Fridays that we're gonna meet up on Friday for 3 to 4 hours. We're gonna discuss the whole course, sorry, the whole subjects of the module until we finish. And there's also the weekend plan, and every second week, that's 7 to 8 hours at Friday, 4 meetings only. So we can basically have 1 module per session. Methods of payments, you can, if you agree, you can also get back to me, you know, my WhatsApp number or my Facebook. You can get back to me on private, so I can add you to the WhatsApp group, and we can arrange for a payment, which can be done either any transfer or bank transfer or whatever. You can decide. You can just inform me on WhatsApp or Facebook before 24th of August, because we want to launch our course as soon as possible in just 1 week. Next Friday is gonna be our first lectures, if we agree. So we're gonna accept some questions right now. So if anyone has any questions, I'm gonna take the written ones first, and then we'll have time for others to ask questions. So let's see. Do you know if the exams after September will be online? Of course, we cannot absolutely guess what's gonna happen. You know, the current situation is unpredictable, very unpredictable. So they might still offer online exams, and they might switch back if all this crisis goes away. But I'm not sure if it's gonna, if the crisis will end by next year. It's very hard to predict what's gonna happen. My WhatsApp number is 0099733808646. So again, I'm gonna write this on the screen. That's my WhatsApp number. If you need to get in touch with me at any time, not necessarily for the course. You don't have to register with me for the course. If you need any advice or anything, you can just pop in and ask for advice. I can help as much as I can, of course, but the help I can provide there is limited. While in the course, I can provide the full potential of what I can offer. Okay, I am 7 hours behind Bahrain time. Is this suitable for me? Will everything be recorded? Yes, everything will be recorded, and we can arrange for a time that can be suitable for all of us. If your proposed time is suitable for everyone, we can surely accommodate you. Dr. Hanan, my number is written on the screen here. My WhatsApp number is here. Okay. And you can also get back to me on Facebook, Sattar Muhammad. Okay, the last one, 100% is the success rate, if that's what you're asking. But overall, I have over 70% passing rate. But for part 2, 100%. So how to scan the area before the exam? Scanning the area before the exam, you can use a telephone. I think they're going to ask you to use the telephone or the webcam. I'm not sure, but you need to check. But you need to check the instructions that they're going to be sending you. Documents to register in the exam. Okay, the documents are passport, photo, personal photograph, BLS. Of course, BLS can be provided online. They accept online BLS. And I can also help you recommend a couple of BLS courses that can be taken online. Your BDS, primary dental qualification. And of course, don't forget the part 1 passing certificate. Okay, these are the, and you don't need to send anything online. You just need to log into postgraduate RCSI, and you're gonna find the postgraduate exams. Postgraduate exam, just Google this, and you will find, and you just have to search for MFD location online exam and exam type MFD part 2. Sorry. Okay. Hold on while I take the others, because there are a ton of questions. Let's see here. Do I need 12 months experience? Previously, they used to require that, but not anymore. I don't think they do require. In any case, you can also get back to them and ask them. Okay. Can we sit, me and my friend, on the same Wi-Fi in the same room? I don't think it is allowed, no, but you need to ask them and make sure. The course is gonna start next week. So if you are interested, you need to contact me before that. Before 24th of August. Contact me before 24th of August. I have MFD part 1 exemption certificate, so am I eligible? If you have an exemption, of course, you'd be eligible for part 2, but you need to make sure that your exemption qualification is accepted by them. Okay. Starting course is going to be started at 24th of August 2020, because we need to move very quickly. We have very limited time. I'm just giving this week for the registration for the exam. If you missed an OSCE, if you missed a lecture, you can always get back to the recording of the previous lecture, if that's what you're asking. Sorry, 24th of July. Sorry about that. 24th of July. Yes. Thank you very much, Dr. iPhone. Is that Ziad? Is that you? How many?
Doctor, can I ask you a question?
Yes, please.
Well, how many hours does the exam needs to be for reading? Because I'm applying for a master's degree in Iraq, so I don't know if it needs much time, or like 2 hours, 3 hours per day is enough.
You'd need to read at least. You'd need to study continuously for 2 to 3 hours a day. It doesn't always have to be 2 or 3 hours a day, but that'll really depend on your background concerning the exam. Okay, that's a good question, because some of you might ask, how much should I need to read or study? Do we need
and
to?
Doctor, one other question.
Yes.
Please.
Yes.
Sorry for interrupting. One
Sure.
other question: is there the past questions, the past exam questions? Will they be repeated like the same question, like the same exams before, or
Some of
due
them,
to this online new?
of course, I
Okay.
cannot know for sure because they used to have repeated OSCEs, like the cephalometric, like the cranial nerve examination, like and all of these. But according to our last trial on June, our candidates have informed us that there were no repeated OSCEs from those 4 or 5 OSCEs that you are talking about. The cephalometric OSCE, there were no repeated OSCEs. So I'm not sure whether or not they're going to have repeated OSCEs from now on. But we will do our best to contain all the required curriculum for the exam. What was the histological section? It was lichen planus, doctor. It was lichen planus, one of the most important ones. Welcome, Dr. Adli. Thank you for your comment. We cannot provide bachelor qualification, but you can provide something to prove that you are a graduate. So for that, you need to contact Emma Scully or Nicola White. I think her email is, I'm not sure, Nicola White at RCSI, but you need to check their website, okay? To make sure that what your papers are acceptable. Just ask them to have a look at them and they will inform you whether or not they are acceptable. Depend fully, no, you should not depend fully on my course. I'm honest in these situations and I'm seriously honest about them. You need to rely on both. We give you orientation, we give you all the information you need, but you're the one who's gonna take the exam. So it'll depend largely on the candidate, but you also have to rely on our revision, on our weekly revision. We will orient you where to read, and we will give you the way on how to answer the questions and OSCEs. It's gonna be directed towards solving OSCEs mainly, because you already have the curriculum. You already know the core curriculum of the exam, and you're expected to have a good knowledge and good grasp of the whole core curriculum of the exam. But in the end, we'd give you orientation, the full orientation you need, but you need to get back and hit the books and get back and recap on what we have spoken about during the during the lectures. Can part 1 MFD expire? Yes, 5 years after MFD part 1, you need to take the part 2, otherwise it's going to expire. Content of the course, we spoke about that, Dr. Hanan, previously. The OSCEs that we're going to be solving OSCEs, and we're going to talk about different subjects that are important for the exam. Part of the lecture is going to be about solving OSCEs. Part of it is going to be about giving you information, giving you part of the core curriculum as required. You don't need to have the whole core curriculum. What if I reviewed the 50 hours of your core curriculum alongside this course? Yeah, that would be great. They can be very useful. Studying past, I didn't say that studying past OSCEs is not helpful. It can be quite helpful, but according to the last time I spoke to that candidate, there were repeated OSCEs, but there were also new stuff, new things, like new OSCEs, new themes. 2 hours, as we have mentioned, for each week, there will be 4 hours at least. And we can also give you on Fridays, 3 hours or even 7 hours on Fridays. The main point is that we have to finish 30 hours before the exam. It's gonna be enough. Online exam fees, I'm not sure. You need to get back to the website for that. Okay, other questions? if you could mute your mics, please, that would be great. Thank you. The course is beneficial from my own experience. Thank you very much, Dr. Iman. Really appreciate your comment. In Iraq, we cannot provide batch. We spoke about that. Any paper that, يعني تأييد دكتور, تأييد. Any paper that can prove that you are a graduate. Okay. Histological slide for every topic. Do we need to prepare? Not every topic. They would not need to ask you to. They will not give you relax. They will not give you multiple myeloma and ask you what is this. No, but the most common ones and the most important ones are the ones that come up in the exam. Doctor, how many hours of preparation do we need? 3 to 4 hours, 2 hours a day. What matters is persistence. Persistence is very important. Okay, sir, please provide sources of where we can do BLS online. Okay, that's a good question. You can just Google BLS online. I cannot recommend anyone, to be honest, but you need to make sure that they are accredited by the American Heart Association. AHA accredited. Accredited BLS courses, but I cannot recommend one in particular. Yes, I meant 24th of July. We're gonna start our course on 24th of July, Dr. Osman. Yeah, sorry about the previous mistake. So where we can do exact date for starting the course is next week, 24th of July, 2020. Can we see? Okay, we're gonna have new questions as well. There are 10 new questions. Thank you very much, Doctor, for your recommendation. How many OSCEs do we need to answer correctly to pass? I don't think it's the number of OSCEs that you have to answer correctly. It's the number of points you collect from these OSCEs. And you have to gather an overall passing mark. Thank you very much. Doctor, I see your name is DR. Could you tell me who am I speaking to? Thank you very much for your kind words. Do we need to answer correctly? Thank you, Doctor. Thank you, Dr. Aziz, for coming. Appreciate your time. How is the exam marked? Okay, how's the exam marked? It depends on the weight of the information that you have entered. And each question has a certain mark, but you'd need to gather enough marks to pass. Yeah. Will you recommend to us what to read on our own to enhance the lecture? Of course. Of course, I'm going to give you all the information and all the resources that you need. Thank you, Dr. Adian, for your comment. When course finish, the course will finish a couple of 1 week before the exam, hopefully. Courses for part 1, we do offer courses for part 1. You just need to contact me and I will arrange that for you. Lecture every Friday, we will agree on that all together. How much is the online exam fees? As you have mentioned, $200. The original price is $500. Yeah, it's been reduced so we can help you during these times of hardship. Passing mark, it'll depend on the difficulty of the questions, but you'd expect to have a passing mark that ranges from 55 to 65. Depends on the difficulty of the questions. They'll certainly have a curve. You're welcome, Dr. Rasha. Could you... could the certificate of part 1 end after 5 years? You'd need to ask Emma Scully or Nicola White for that. You'd need to make sure whether or not you'd need to have a fresh and new MFD Part 1 exam. Thank you, Dr. Rashid. Thank you, Dr. Deepti. Diploma in primary care, that you need to also ask the Royal College of Surgeons. When we take the command to us what to read. Yeah. Okay, any more questions? I think that's about it. So anyone has any questions? Thank you very much for your attendance, and thank you for your dedication, and I hope you all pass the exam from the first trial. If you need anything, you can contact me anytime. Okay, good luck all, and good night. Have a great day ahead. Thank you, bye. It's gonna be recorded, so I'm gonna provide the recording later on for those who want it. Goodbye.